Hello, 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 Facebook. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Hi, Chanel. Hi, Tommy. And I'm sorry, I told y'all I was going to come on yesterday. And when I said that I was going to do that, I probably shouldn't have because I've been sick for the last few days. And the more I spoke, the worse my throat felt. And so I really didn't feel up to it last night. And if I start coughing, I apologize in advance because I've had like the worst sore throat and like head cold for the last couple days. But when I saw about the lady that just died, I think it was this week in Tijuana, and I saw a question someone asked on the bottom of a post, why it seems that people die more during liposuction than other procedures. I was like, this is a great question because I've tried to explain it other times before. But, I guess the more these unfortunate situations happen, I think the more people are willing to listen. So when I saw somebody actually ask the question, I wanted to address it again. Yes, Tommy, I have not been well. In fact, I canceled a surgery on Friday. I had a liposuction case Friday morning, and I was so under the weather that I didn't even think it was fair to do a procedure on someone. Plus, I didn't want to get her sick, so I had to reschedule somebody. And I've only done that 3 times in my career. That was the 3rd time. Hey, Natasha. So a lady and someone died a few weeks ago, and I was gonna talk. I can't remember where that lady. I can't remember where her surgery happened. But the lady that I saw, saw the report of her death, was yesterday. And I saw it on Instagram, and then I looked up the story. I Googled the story to try to get a little bit more information. I'm not really sure what happened with her. So the things that I say today is not specific to any case. I'm going to speak in general about the things that I've seen, with the different deaths and just knowing about liposuction. I'm going to speak in general about some of the reasons why liposuction can be more dangerous than other things when received by the wrong people, or if the person doing it has lost sight of what they're supposed to be doing, then it could be a very dangerous thing. So the thing about liposuction that actually sets the patient up to be hurt, is the fact that the incisions are really small. And so people don't see liposuction like surgery the way they would see a tummy tuck like surgery or a breast surgery. Because, with a lot of the other surgeries, there's these long incisions and, you're taking care of this stuff after the surgery to try to nurse yourself back to health. But with liposuction, the incisions are teeny tiny. And so it's just like when people get laparoscopic surgery, they have these teeny tiny incisions and they don't realize that a lot of surgery happened underneath. So with liposuction, we're using these little bitty teeny tiny incisions to access a large surface area of fat. And so the reason why that's dangerous to the layperson is because they're perceiving the incisions. Since it's little incisions and it's a little surgery, they're like, oh, a little lipo. Whenever people say a little lipo to me, it tells me right there, their perception of what's happening isn't correct. People think since the incisions are small, the risk is small. And I've said this before, since the incisions are small, the risk is larger if the person who's doing it is inexperienced or has no real training on the anatomy underneath it, because essentially they're operating blindly. The smaller the incision, the more skill is required of the surgeon to do the operation safely. So, because they can't see. So if you think about it, if you're getting liposuction on your entire torso through 3 little holes that are this big, the person can't see most of what they're doing. It's done by feel and knowledge of the anatomy. So if you have a person who is not really surgically inclined, they aren't even really appropriate to decide if you're safe for surgery. You need to be checked for a hernia prior to surgery. If you have a hernia underneath the skin, in the fat, and the person hasn't even checked you, nor do they really appreciate how to check you for one, and then they go and start doing liposuction and ramming this cannula blindly through these fatty tissues, and a hernia happens to be there. What lives inside of a hernia is bowel, intestines. So then they can ram this cannula into your intestines, and that's one of the things that causes major issue that could lead to death or major complication, long hospitalizations, horrible infections, is bowel injury. And bowel injury can happen in one of two ways. It can happen because you have a hernia that was undiagnosed and the person is ramming their liposuction cannula through your intestines via a hernia. Or it can happen because they have gone through the entire abdominal wall, so pierced through your muscles and everything, and got down to where the organs are and damaged the intestines. So that's one way that a person can end up with really horrific complication or death from liposuction. Undiagnosed hernia, and injury to your intestines because of it, or if the person, you don't even have a hernia, but the person goes all the way through the abdominal wall into the abdominal cavity where the organs live, and then if they go in there, they can end up damaging your liver, your spleen, your intestines. If they hit the large intestines, that will set you up for sepsis, really, really bad infection. And even if you don't die, you could end up with, the complications that can come from a bowel injury is just endless. So these are some of the things that can happen just from a little lipo through those little bitty incisions that people think, oh, not a big deal, just a little bit of lipo. And the problem with liposuction is, since we've come up with ways to do liposuction without you needing to actually go to surgery, to the operating room, you can get cool. Okay, Maria, cool sculpting is not without risk either. So, if you have a hernia and they pull that tissue up into that cool sculpting head and freeze it, and your intestines are in there, that's a problem. So going to these places where they have all these things and the people who are deciding if you're appropriate for it aren't really equipped to decide if you're appropriate for it, you're still at risk. There's nothing without risk. That's why you need to be in the hands of people who have been trained on it, not just people who are just trying to make some money. So back to liposuction. No, lipo with fibroids. Fibroids have nothing to do with liposuction. That's in your abdominal cavity. So as long as the person is doing liposuction in the right plane and they know what they're doing, you having fibroids is totally unrelated. The fibroids live in a different cavity than where the liposuction should be taking place, if the person knows what they're doing. So the other way people tend to have really bad complications that can lead to death from liposuction is aggressive liposuction. I literally hate that phrase. Like, I had thought about doing a live video some months back that was that I was going to entitle, and I don't know why I never did it, the questions that can get you killed in plastic surgery. And asking, do you do aggressive lipo, is one of those questions. In fact, that's the question that made me want to do that Facebook Live. Because aggressive lipo is asking to be hurt. What that means is the person's going to liposuction you. Like, usually the people asking that question are the people who need to lose weight before they get liposuction, which is why they want aggressive lipo, because they're trying to use it as a weight loss tool because they don't want to do the work. So liposuction is designed to help with trouble areas. It's not supposed to make a fat person skinny. And so when people are getting aggressive lipo, they're trying to get all the fat out in the area that they want in one operation. And so then you have these people who are so busy trying to make sure they don't lose the lead. Okay, so now we're putting our business hats on as the person who's running the facility. They're trying to not lose the lead. And so the person says, I want aggressive lipo. They're trying to make sure they don't get bad reviews. They're trying to make sure they don't lose the lead. They're trying to make sure they get the money. And then this person who needs to lose weight or maybe have 2 rounds, if they're trying to get to a certain place that's not realistic to get to in one surgery, then they'll do this aggressive lipo foolishness, and folks be taking off 8-9 liters of fat. And I've said this before, when fat comes out, blood comes with it. And most people, when liposuction is done, the average person is going to, about at least a third of what is removed will be blood. So if somebody takes 8 or 9 liters off of you and a third of it is blood, then that means you've lost 3 liters of blood, which is not really compatible with life. So then you get these people who will go into cardiac arrest on the table. If you lose too much blood, your heart can't function. Your heart pumps blood through your body. If you have lost it all in the liposuction in the liposuction canister, then your heart will fail. So when you have these young people going into cardiac arrest on the table, one of the reasons why that could happen is because of a large amount of blood loss. I have heard many reports of people who, even in Atlanta, where they'll be staying in these hotels after the surgery or at these recovery houses after surgery, and they've been liposuctioned to death because they've gotten aggressive liposuction. And then ambulances are pulling up to the hotel, or the recovery houses are having to call 911 because these ladies are laying there about to die, and some of them do die. And it's because they've lost too much blood, because they got aggressive lipo. Like, you shouldn't even ask that question. You shouldn't be trying to, if you need 8 liters removed, you need to lose weight. You shouldn't be getting liposuction. If it takes that much to get you to the place you're trying to go, you need to lose weight first. It makes no sense to remove 8 liters from somebody. I saw a surgeon on Instagram, it was probably about 6 or 7 months ago, and he had 10 liters of fat on. I'm like, this fool actually posted that on Instagram. That's how I know he lost sight of what he's supposed to be doing, because he should have been embarrassed to post all that fat that he liposuctioned off of one person on Instagram, because I'm sure his colleagues who still have ethics were looking at that the same way I was. Like, did you really just take 10 liters off of somebody of fat? Like, that doesn't make any sense. That's how you kill somebody. You take 10 liters of fat off. Blood is in all of that. You can't live without blood. So when people will come to me before, I think because of these videos and my stance on things, certain folks don't even bother to come to me now. But before, when I first started here in Atlanta, people will come and be like, well, how many liters will you take off? And I'm like, my max is 5, but I rarely go to 5. Rarely do I take 5 off. I can count on one hand and have fingers left over the number of times I took off 5 liters. I've come to 4, 3 is very common, but 5, literally it was less than 5 times that I did that. And those people who I did that on, it was the person, like, sometimes I'll get it's so exciting when it happens, but I'll lipo and nothing comes out but fat, and there's like no blood in it. So if I get to the first liter and 900 of it is fat, I can keep going. I'm like, yes, honey, I'm gonna keep going. That's so rare. So it's rare that I would take off 5 liters, because a third of that is still a lot of blood. So when you were running around asking somebody if they do aggressive liposuction and I want aggressive liposuction, you're like literally asking them to put you in danger. Because most times and most people, if you're doing 6 and 7 and 8 and 9 liters of fat in one setting, you're removing so much blood that you are literally playing Russian roulette with your life. And then the sad thing is, folks will leave there and go to a recovery house